here is the preprint of the study. This is a study which contains honey, Nigella, Sativa, and that combination given to patients versus placebo. It's a double-blind, randomized, controlled study. So we're going to look at it, and it is a preprint. So let's just look at the other links that I have here. This is the study on the clinical trials, and if you see here, this is the dosage that they used. Honey, 1 gram per kilogram per day, and Nigella, Sativa, or whatever is we call it Kalonji, or black cumin, 80 milligram per kilogram per day. That is the medicine that they used. Beautiful results. I was actually surprised to see those results. Then here is a very decent article about the components of the Nigella sativa or these seeds. So what is part of what are the things in it, and the mechanism of action of various components in this. So this is a good study. Then I have the main active ingredient in Nigella sativa, which is thymoquinone. That is here. And then finally, it has it is part of quinine as well. So hydroxychloroquine and the others, they have a tiny part of this Nigella sativa's active molecule thymoquinone in it as well. So there are different things, but still there is one ring in the hydroxychloroquine and chloroquine that comes from Nigella sativa, the thymoquinone part. So with this, let's look at this study. I think you would like it. So let's start. And here is the preprint PDF. I'll go over something. Actually, let me show you one thing that really caught my attention, and then we'll go to the illustrations. Sorry, just 1 second. Check this out. This is, I think, the most important part. So once again, it is an inexpensive seed called black seed, and it is over the counter, available everywhere almost in the world. And look at the mortality reduction when used for COVID-19. Check this out. Mortality amongst severe cases. So I have gone way ahead at the end of the study, and I'm talking about mortality. But I want to put that case in front of you first before we talk about everything else. Mortality amongst severe cases in comparison to control group. Now check this out. 27% versus 25% for hydroxychloroquine. So they were giving to some patients hydroxychloroquine, I believe with zinc, and the difference they saw was 27 versus 25%. So I think they didn't see a lot of difference. And again, this is severe cases. So you know that in severe cases, usually hydroxychloroquine is too late to use at that time. So it's not hydroxychloroquine's fault that the data is such. It is just used in a severe case. Then 19.2% versus 25% for lopinavir and ritonavir. So slight improvement if you are using antivirals. Again, severe cases may not actually be responding to antivirals because they are in immune dysregulation. So I do not know since when did they start giving them antiviral. Did they start it when they were on the shortness of breath, and when they had the shortness of breath and they got admitted, then it is a fair comparison. Then look at this, 15.7% versus 24%. So 15.7% who received the convalescent plasma and 24% who did not receive the plasma, the mortality rate. 11.4% versus 15% for remdesivir. So those severe cases or those patients who were receiving remdesivir, 11.4% died in their study, and 15.2% died in placebo group. Dexamethasone, 22.9% versus 25.7%. And check this out, for honey and Nigella sativa combination, the mortality rate was 4% versus in the control group 18.87%. 4 times reduction in mortality. I remember my mother, so my mother used to feed us, give us this Kalonji every day. And she used to say that it is said that these seeds have a cure for everything except death. So these used to be given for almost every kind of disease. But I was impressed by the mortality reduction numbers here. Now let's look at it from my illustrations. First of all, honey and the combination in this study that they used was, let me just take the layer panel off. So what they did was they used honey and they used Nigella Sativa. These were the two things that were given in combination. We saw the dose before. Now, interestingly, in silico studies, that means on the computer, and in vitro studies, that means outside the body in the petri dishes, or in the lab, both of these substances have been observed to reduce the SARS-CoV-2. So the question is, we're going to look at it, that how does that work? So in the Nigella sativa, the main important ingredient is thymoquinone. In addition to that, it has nigelladine. So here, if you see nigelladine, alpha-hedrin, zinc, quercetin. Because it is a seed, it has flavonoids in it, which contains quercetin. So zinc and quercetin together in it, and vitamin C, other than many other vitamins and other substances. So check this out. This is like somebody created the whole recipe for prophylaxis and put that in one place. Thymoquinone, that is I hesitate to say it's similar to hydroxychloroquine, because hydroxychloroquine is a bigger molecule, has more things in it. But one active part of hydroxychloroquine, or quinine, is this ring, thymoquinone ring. So thymoquinone here, then zinc and quercetin here. So imagine if you have hydroxychloroquine, zinc and quercetin all packaged in one area. So that is a kind of thing here. But once again, please realize that hydroxychloroquine and quinine is different from thymoquinine. They are not the same thing, or thymoquinone. So these are the active substances. And look what they do. The studies that have used them, what is the effect they have seen, especially for respiratory conditions. They have seen that when you use Nigella sativa and honey, pulmonary functions tests improve. So pulmonary functions improve, number one. Number two, respiratory symptoms improve in patients. Cancer cell viability is reduced, meaning cancer cells die more easily. They proliferate less, they die more, they apoptose more. I remember my mother's sister, my aunt, had breast cancer. She used to be in UK. We were young. She eventually died of it. And I remember we used to pack these Nigella sativa and send it to her. So she did not make it. But anyways, in those cultures, these seeds have a lot of function. So now let's look at the study. The study was interesting. They did the study from April 30th to July 29th. The link that I showed you is a preprint. It's a relative, I won't say small, it is not lesser than 100. If you see, 210 people in moderate patient group and 103 people in severe patient group, so decent size. Significant results. It's a multi-center, placebo-controlled, randomized study. What they did was they had given 1-to-1 distribution. So some people, half of the population got the honey and Nigella sativa, other half got placebo. And the objectives were, they were trying to see if the symptoms will be reduced or alleviated early, that is one. If the virus would clear early, that is two. And if the 30-day mortality will be reduced. So these were the three things that they were observing. I think when you'll see the results, you'll be impressed, and I am impressed. And I really think that this is another interesting thing that at least we should use for prophylaxis. So what they did was, in the moderate group, they had 107 people on honey and Nigella sativa, and 103 were on placebo. In the severe group, out of the 103 people, they had 50 people on honey and Nigella sativa, and 53 were on placebo. That was the division. Now look at the results. Look at the results. Alleviating the symptoms. Honey and Nigella sativa, within 4 days, the symptoms were alleviated. Placebo, 7 days. This is the moderate. So the first line is the moderate, the second line is severe. So in the moderate, hazard ratio was 6.11, 95% confidence interval is 4.23 to 8.84, which means it is on one side of the unity, which is excellent. And p-value, look at this, 0.0001. So the chance for randomly this data to appear with placebo is 1 in 10,000. So it's a very decent p-value. In the severe cases, the symptoms were alleviated on average by 6th day, compared to other patients who were not getting it, placebo group, 13th day. And look at the hazard ratio, 4.04, 2.46 to 6.64. Again, on one side of unity and quite pushed from it, which means it is good. And the p-value, once again, is very good. Viral clearance in moderates within 6 days compared to placebo, 10 days. And if you look at it, this all is significant as well. In severe patients, 8.5 days versus 12 days. And again, p-value and confidence intervals are significant. Clinical score on the day 6. How have the patient been improving? What is their situation? So in moderate cases, on 6th day after receiving this combination, patients resumed their daily activities. So 63.6% patients who were receiving this combination resumed daily activities, while 10.9% patients who were receiving placebo were able to resume their daily activity. This is huge. And again, the data is significant. Hospital discharge in severe cases. Check this out. 50% on honey and Nigella sativa. 2.8% on placebo. This huge difference. And again, data is significant. Odds ratio 0.03. Beautiful, beautiful data. Mortality. Honey and Nigella sativa patients, 4% mortality. And this is severe. So we're not talking about all patients. On average, out of 100 all patients, that includes asymptomatic, symptomatic, mildly symptomatic, moderately, and then severe. Out of all of them, 4%. And we know that out of severe, at least 30 to 50% of the patients die. Here, check this out, mortality in HNS, 4%. And in the placebo group, which were receiving other things, 18.87. And odds ratio 0.18, so about 82% improvement. And 95% confidence interval is significant. The p-value is significant as well. And there were no side effects observed for this. I was actually blown away when I looked at this data. I loved it. And these things, these seeds, once again, I might be looking like I'm selling these. I don't sell them. But it is just interesting. These seeds are available for cheap everywhere. So now I want to go over some of the salient points of this study as well. Did I mention how it actually functions? Where did that slide go? So 1 second. Yeah. So I want to show you how does it act? What is the action in it? So check this out. I missed this part. Nigella sativa and honey have an antiviral effect. And what happens is both of these components have high affinity for SARS-CoV-2 enzymes. So when the SARS-CoV-2 arrives in our cell and is making its own proteins and enzymes to build its own new daughter SARS-CoV-2s, these substances bind to its enzymes and disrupt them. So that is the antiviral effect. Then antioxidant, of course, there is vitamin C and other substances that act as a radical scavengers. So it is antioxidant as well. Then anti-inflammatory. Nigella sativa is known to suppress the cyclooxygenase and lipoxygenase pathways of inflammation. And then finally, immune modulator. It can modulate and balance out interleukin 1, 6, 10, 18, 8, tumor necrosis factors, nuclear factor kappa B, which we talked about it yesterday as well, and then day before yesterday, and interferon production modulation. So all immune system mechanisms are modulated, inflammatory mechanisms are modulated, antioxidation is done, antiviral properties are done. So beautiful thing. And I want to now, this is the last part. Let me go over some of the things here. So, so here is the study. They've done a good job. I would recommend, if you can download the study, the mechanisms they have explained very well. But I want to just go over some of the things. So look at this. This is honey. In silico molecular docking studies have shown that 6 flavonoid compounds from honey might inhibit severe acute respiratory syndrome, coronavirus 2. So that is one thing. Then if you see, there is more that they've discussed, T cell, B cell modulations. Most of these things we know. Now on the Nigella sativa, it also has shown to decrease the replication of SARS-CoV-2 in vitro in cell cultures. Molecular docking studies have shown that some of its components, such as nigelladine, alpha-hedrin, and thymoquinone, have high affinity with several SARS-CoV-2 enzymes and proteins. So it binds with them and disrupts them. In fact, check this out. They exhibit an energy complex score better than that of chloroquine and hydroxychloroquine. So imagine in this little seed, in this thing here, it has thymoquinone plus zinc plus quercetin, all three packaged together. And so it shows a better energy score to disrupt or to help with the zinc and then disrupt the virus. So that is beautiful. It also demodulates the secretion of number of pro-inflammatory mediators and improves helper T cell, CD8 T cells, which are cytotoxic T cell ratio, and increases natural killer cells. Remember from the beginning of the discussions, I've been saying we need to find ways to improve our natural killer cells. And in that, we talk about yoga, we talk about forest breathing, forest bathing, we talk about relaxing, better sleep. So here you have one more thing in your arsenal that you can actually use Nigella sativa with honey combination as well. So again, please realize that honey is sweet. And so folks who are diabetic, they should be careful and talk with your doctor or check your diabetes sugar levels when using it. Then some more things here that I have highlighted, not a lot, but some things that I wanted to show you. They have captured good data as well. And so then they say all data combined is suggestive of robust therapeutic profile of honey Nigella sativa, and results can be highly encouraging amidst current second wave of SARS-CoV-2 infection. So this is the discussion for today. Discussion is done by, so when I read this paper, it reminded me of my own time. I studied from King Edward Medical College, which was Pakistan's best medical college when I was doing. Now there are Aga Khan College, which is supposed to be great, but I think King Edward is awesome. And with that, Mayo Hospital. And on the other hand, there was Allama Iqbal Medical College with Services Hospital, and then they have their own hospital as well. And so we always used to kind of have a competition. So this study is coming from Sheikh Zayed Hospital and Services Medical Center, So services is a good hospital as well. So I love the study that came out, and I love what is presented in here. So that is the discussion for today.